Screening, brief intervention, and referral to treatment, SBIRT, is a proven way to identify, reduce, and prevent substance use issues. Chris is 37 years old. He completed a screening for alcohol that all patients fill out at routine clinic visits.
Hi, Chris. My name's Jillian. I'm a health educator. How are you doing today?
I'm doing okay. Work's been a little stressful, but I'm getting through it.
There are several validated tools that can be used to screen for alcohol and other substance use. In this case, it's the Alcohol Use Disorders Identification Test, or AUDIT. This screening identifies lower to no risk, hazardous, or harmful use and alcohol use disorder.
Thank you.
Jillian, the health educator, scored Chris's screening.
I am having some trouble, staying asleep at night, so I'm just wondering if there's something I should consider taking for that.
If we don't get a good night's rest, it kind of makes it difficult for the rest of our day. If it's okay with you, I'd like to speak with you for a few minutes about your screening results.
I don't really consider any of that to be an issue.
It's definitely something that we ask everyone that comes in. We think of it like a vital sign, like taking your blood pressure or looking at your heart rate.
Okay, we can talk about that.
Jillian is leading a brief 3 to 5 minute motivational conversation to offer feedback and encourage change.
Something that you marked on your screening is that you're drinking about 2 or 3 drinks in a day on average, and you're having 4 or more drinks at least on one occasion about once a month. Is that correct?
I do have a couple drinks, after work in the evenings to help me unwind, and again, it helps me to get to sleep at night. And then when I am meeting up with my friends on the weekends and we're playing golf or get together to watch the game, we may buy a 24-pack of beer and split it amongst the 3 of us.
Well, thank you so much for sharing that with me. I'd like to share with you first the low-risk drinking limits. So this is a card right here that you can take with you today. What we recommend for men is no more than 14 drinks in a week, which breaks down to no more than 2 drinks in a day, and no more than 4 drinks on any occasion. One of the things that you indicated today that was really important to you was your sleep, and one of the things that we know about what alcohol affects in our sleep is our REM sleep. And so what that really means is that we have poorer concentration, we can be more groggy during the day, and then it makes it harder to stay asleep once we've fallen asleep. What are some of your thoughts about that information?
I guess I've never connected drinking to some of the issues that I've been having at night, so it's kind of surprising to me.
Something else that I wanted to share with you related to blood pressure, because you also said that was important to you, is that when we are drinking over the low-risk drinking limits, it can have an impact on our blood pressure, both in the short term and the long term. So, for example, if we're drinking more than 4 drinks on one occasion, that can raise our blood pressure. And then if we consistently drink in excess, it can raise our blood pressure over time. What are some of your thoughts about that?
Again, I've never considered how my drinking could be affecting my blood pressure. That has been something that I've been trying to pay attention to, and it is important to me.
It sounds like your health is very important to you. What might be some steps that you could take in learning this information today that might help your health?
I can try to cut back on the number of nights that I come home and have a drink or two to unwind, and then again just trying to pay attention to and think about this information when I'm getting together with my friends.
What might be some other reasons why lowering your drinking would be important to you?
I did lose my father a couple years ago to a heart attack. He was suffering from several heart conditions for quite a while, so it's, again, something that's always been in the back of my mind.
I'm so sorry to hear about your loss with your dad. Just out of curiosity, where would you say you're at on a 0 to 10 scale in being ready to make some of these changes after today?
And I'd maybe put myself somewhere around a 5 or a 6 maybe.
So a 5 or a 6, why didn't you choose a 2 or a 3?
This is surprising information that we've been talking about, but I think based on that information, it would be important to consider cutting back and seeing how it impacts my health in a positive way.
Great. It's important to remember that there is no healthy amount of alcohol to drink, that we do consider alcohol to be a toxin. So it's great that we're speaking about this today, and because this is a sensitive subject, I appreciate you having this conversation with me. What would you say might be some challenges that would get in the way of working on some of these steps?
I guess it's just sort of been routine, to come home at night and pour myself a couple drinks, or again, when I get together with my friends, it's just what we do. I've never considered it to be a negative impact. I could see it being a little difficult, especially maybe changing my ways around my friends and how they may react to that.
Absolutely. Our friends have a big influence on our behavior. How might you start the conversation with them to support you in making these changes?
They respect me, and so if I told them I was doing it for my health, and again, they all were close to my father as well, and they know how his health, unfortunately ended his life young. So I think they would respect that.
Well, it sounds like you've come up with a really great plan. And remember, in the end, it's up to you and the steps that you take after today. I'd like to follow up with you in a couple weeks to check in on how things are going and see how your sleep is doing as well as your blood pressure. And if things haven't improved, we can explore other options then. Will that plan work for you?
Yeah, I do. I think that would work. I would be willing to check in a couple weeks.
Okay, great. Thank you so much for having this conversation with me today, Chris.
Several brief interventions may be more effective than one. Many types of health professionals can provide effective brief interventions.